Welcome back to Today's Health, and we're talking about hip pain. Okay, Dr. Karadimas, let's talk about non-surgical treatment options.
Okay.
What are they?
So I think what we'll do, I guess, is kind of break it up into the couple of problems that most people are going to have. It's going to be some type of joint problem. By joint, I mean ball and socket problem. Arthritis, impingement, cartilage tears. And then you have the outside of the hip problem, which is the bursitis, because bursitis is on the outside.
Okay.
So in terms of non-surgical treatment for bursitis, we kind of talked about this earlier, anti-inflammatories, Motrin-type medications, steroid injections, very helpful. Physical therapy is also very helpful for that particular problem. And when we get to the actual ball and socket hip joint issues, it's a little bit more complicated. By that I mean, yes, you can take pills, oral anti-inflammatories. They tend to be less effective. The bursitis is an actual inflammatory problem.
Right.
It's inflammation. Whenever you see that itis at the end of something, that means that there's an inflammatory component to it. When you have a problem within the ball and socket joint, it's typically mechanical. Something's not right. So you're not really treating the cause of it. You're trying to cover the symptoms up with pills.
Gotcha.
So that's why they don't really work that well. You can take them. But basically, with the understanding that whatever the problem is, arthritis, impingement, cartilage tear, you're just covering that problem up.
That makes perfect sense. Well, let's, what kind of medication are you giving with injection for bursitis, and how can you have that like repeatedly, or how long does it last?
Great question. It's a very common question for folks to ask me, because certainly if it helps them, the last thing anybody wants is surgery, right? I mean, nobody really wants that, especially if we can help them and it's not a detriment. So in terms of the bursitis part of it, I usually kind of play that by ear, but I think as a rule, you could probably have anywhere from 3 to 4 injections a year, as long as they're benefiting you for a period of time, Barb. And it's going to vary person to person. I think if you're a 85-year-old lady who has medical problems, who's a high-risk surgical candidate, I think for that patient it can go on forever.
Okay.
If you're 40 years old and we've done these injections for quite some time, a year or 2 years, and you're not, you get a short period of response, improvement, then you might want to look for other options. In terms of the actual ball and socket joint, that's a little bit more complicated. What makes it more complicated is you really can't give a shot like that. You can't with accuracy get into the hip joint in your office. So that turns it into a take you to the hospital procedure. And that's a tough one. I mean, you take someone to the hospital to do an injection in the hip. I do that for folks, but that is very limited. Once, twice, and see what that does for you.
Okay, see if you get the pain relief and how long it lasts for the actual hip joint.
Correct. The caveat of that being, is there isn't really a detriment to actually doing the shots in the hip joint for like arthritis. Mm-hmm. It's just that taking you to the hospital and subjecting you to a general anesthetic increases the risk. So we always look at risks and benefits.
Gotcha.
So if you so you look at the risks of that are certainly greater than normal.
And how long can you stay on the anti-inflammatories to mask the symptoms?
That is a sort of not the age-old question, but I think as time, if you would have asked me that question 10 years ago, I would say indefinitely. But certainly knowing what I know now, the risks are, I think, much greater than we all thought in terms of being on these anti-inflammatories for a long period of time, chronic period of time, greater than a year. I think you have substantial gastric risks, GI risks, and there are some cardiovascular risks that we're now discovering. So I am actually not a proponent. I'm not an advocate of chronic anti-inflammatory use.
Well, then let's talk about physical therapy. That's the last thing you mentioned.
Yeah.
How can that help pain?
So again, we'll break it up into the 2 categories. You get the bursitis, the inflammatory problem. There are things that they can do in physical therapy. Ultrasound, iontophoresis, basically using steroid creams and ultrasound to penetrate that through. So things that actually have anti-inflammatory effects. Stretching of that tendon that sits on the outside of this hip that contributes to bursitis, very helpful. when you look at arthritis in the hip, to be quite honest with you, I have not seen a great benefit with therapy, and the literature would not support a significant improvement or recommendations for treatment for folks that have arthritis in their hip.
Great information. We're going to come back and talk about surgical options, but we're going to take a break.